So let's bring in Dr. Kevin McHale for another edition of the Injury Report. And, of course, the Injury Report, the blue tent was a big factor in the game the other night. It's brought to you by Cape Regional Health System and Dr. Kevin McHale with Penn Orthopedics and Cape Regional Health. It's the best of both worlds for a healthier life. For an appointment, call 609-463-CAPE or visit caperegional.com/orthopedics. Doc, welcome back. We've unfortunately got a plethora of topics to get into this week. How are you?
I'm doing all right. I'm much better than most of the NFL right now. It was a rough week.
It sure was. So there's so much to get into here. Let's start with number one. A question that with the Eagles has come up a lot the last couple of days is why so many soft tissue injuries, calf injuries? You got Goddard, Jeffrey. These seem to linger. Is it, the lack of the preseason reps that has been off? Let's start with that. Why do you surmise there's so many soft tissue injuries?
So we know that there's a kind of a collection of risk factors for soft tissue injuries, and some of them have to do with the training that you would get during the preseason. Because one of the biggest risk factors for soft tissue injuries is fatigue. So when your conditioning isn't optimized and you're not at the peak level of performance that you would be in the midpoint of the regular season, you have a much higher risk of these injuries. Also, we see it with muscle imbalance for those players that are coming off some type of injury where they're not quite at full strength, or maybe their left leg and their quad's a little weaker, puts them at risk for soft tissue injuries. And also the risk of having a prior injury puts you at risk for re-injuring it again, which we see with Goddard. Having injured that calf over the preseason, gotten the rest he needed, gets back out to playing, and by week 2, it's re-aggravated. So these things are very frustrating because, a lot of times they do, feel okay. By 2 to 4 weeks, we see them back out there playing, and they're playing as if it never happened. But many times these symptoms can linger and cause pain for up to 4 to 6 weeks. And even though they're on the field, it's still bothering the players and kind of definitely hampering their performance.
Doc, I think guys like you take a lot of heat for these things, but I think it's something that you should explain to the listeners. From what I've been told when talking to guys like you, you worked with the New England Patriots, so this is something you can directly relate to. Your job is treatment, not prevention, right? Like they say, what the heck is going on with the medical team? Why are all these guys getting hurt? They're yelling at you, but your response would be, look, we're here to treat them when they get hurt, not prevent them from getting hurt, correct?
So that is true. I mean, there's a team. So the doctors work with the athletic trainers, and the trainers work with strength and conditioning coaches, and they all work together to try to get these players to optimal health. And they talk about overall strategies to try to make sure that players train appropriately and are conditioned appropriately to make them at their peak level of performance when it's ready to play and decrease the risk of injuries. And a lot of times, there are certain prevention strategies that are implemented in all these teams. We know there's certain types of strengthening programs that can help decrease rates of injury, certain types of conditioning programs with high intensity interval training that helps decrease rates of injury. And these are all implemented across every NFL team, but it still won't decrease that risk to zero. And we know that the NFL is a tough sport, and it's one of these sports that just puts at a high risk of injury for every athlete on the field. So even though the medical staff does get a lot of the heat, unfortunately, there's nothing that's perfect as a way to prevent all of these injuries across the board.
Now, Doc, just to not to continue to throw your resume out there, but you worked with the Patriots, the Bruins, and the Celtics, correct?
The Red Sox, actually. Red Sox, Patriots, and Bruins, yeah.
Okay. Football has to be, by far, the guy. I mean, you probably see way more guys coming in, bodies beat up, injured, than the other sports, correct?
Yeah, I mean, between football and hockey, for sure. I mean, they're just such tough sports. These guys are incredibly tough athletes. But football, with the limited schedule, you see every regular season game has major injuries and across every team. And it's unfortunately such a tough sport for players to make it through the whole season. I mean, we just see constant names across the NFL. It's going down for season-ending injuries like ACL tears. It's unfortunate how high the rate of injury is. And they are implementing a lot of things to try to prevent that, but it's just a dangerous sport overall.
All right, Desean Jackson. This one's odd because some are saying groin, some are saying abdominal strain. Do you think, hearing both of that, there could be a correlation between the two? Because some have suggested it's a sports hernia. Tim McManus reporting that he's been dealing with a abdominal strain. Then others have said it's been a groin issue. Is there a connection between the two? When you hear a lot of different information, does that kind of put up some red flags?
Not necessarily. That's actually really, really common when you're talking about sports hernias and this type of issue as a whole. But when we're talking about this area of the body, that groin area, you have your pubic symphysis bone, which is that bone down there by your groin, and you have muscles in your lower leg or on your thigh, on the inside of your thigh, called your adductors, that attach that bone. That give you the strength to bring your legs together. And then the lower end of your abdominal muscles attach that bone as well. So when people have pain there, we call it oftentimes the sports hernia, which is the layman's term for just this area of pain in the groin, and it involves some combination of these muscles. So a lot of times when you hear that term sports hernia thrown around, it's not unclear what type of anatomy is involved. It's just because it's just a general area that's bothering them. And the question is, and it sounds like in D-Jackson's case, it's more his abdominal muscles that are strained, but it kind of doesn't matter in that it's all the same when it's getting treated initially. You know, they're going to try to rest them, they're going to rehab them. Hopefully they can get them back to playing at a high level this season. This is definitely one of those injuries that tends to linger. Hopefully he's able to get back to a good level of performance and he's done with it. But if he's able to tough out the season, many times if the pain can persist, they may have an all-season surgery. Occasionally it may hamper their performance so much where they need the surgery during the season. Then you're looking at like at least a 6-week recovery time frame. So you're hoping that's not the case. It doesn't seem to be the case, at least not what they've reported so far. So hopefully we'll see him back out in the field in only a few weeks.
Tim Jernigan, broken foot. Now we've heard Liz Frank stuff. That put people out for the year. No surgery here, but they still say 4 to 6 weeks. But when you have a broken foot, you're that big in that position, there's got to be some concern.
Yeah, there's definitely some concern. So the real question is, where exactly is the fracture? You know, what's broken, and that will plays a major role in how long it's going to take to get back. Assuming it's the metatarsal bone, which is that most commonly fractured bone right in the middle of your foot that provides that arch to your foot. If it's a non-displaced fracture, they do heal pretty reliably, as opposed to that Liz Frank fracture, unfortunately, that Mike Jackson had, where it involves the Liz Frank joint. It's the base of the metatarsal bones, but it also affects the joint. That joint requires a long time to heal, and that's why it's such a long recovery and a season-ending injury. If it's just a cracked bone that can heal, it does heal reliably. Now, the 4-week timeline seems a little optimistic. It just depends on what's fractured and where it is. I'd like most likely leaning towards the 6-week timeline, but again, it depends on where the crack is and how it heals. Hopefully he'll be out there and definitely much better than Mike Jackson, that's for sure.
Dr. Kevin McHale with us as we look at this week's injury report. And all right, everybody wants to know, Doc, what goes on in the blue tent?
So, to the blue tent. I mean, the blue tent gets a bad rap because anytime you see a player in there,
the blue tent gets a bad rap.
The blue tent never hurt anyone.
I like that one.
Yeah, the poor blue tent, you know. But, you know, the biggest thing is, one of the first things you learn when you're dealing with a pro team is you don't do anything on the sidelines that if a camera catches you, everyone knows what's going on. And it's something where, you know, those sideline exams, you're under intense scrutiny. You have the media, you have all these kind of cameras zooming in on you. And if you can easily kind of show a lot to everyone around at that time. So the blue tent just gives you the privacy to do a good, quick exam on the sidelines without a camera zoomed in on you. And it depends on what's going on at the time. If it's a concussion eval, you do a quick concussion assessment to rule out a concussion, and there's a kind of a quicker assessment you do on the sidelines. And if it's positive, then you go back to the locker room and do the more formal evaluation to rule in or rule out a concussion. If it's another injury, maybe it's a knee injury, you can do a real thorough exam without a lot of cameras on you. So when you're releasing that player to play, you feel confident in your exam. It wasn't just a quick thing with people kind of covering you, so that way the camera didn't zoom in on your exam of the patient.
Yeah, that thing got a workout last week against the Atlanta. That was a physical game, to say the least. And I guess another question that has been floating around is, you know, what is the process of declaring a guy in or out? You know, Goddard, he wasn't inactive, but then all of a sudden they decided, you know, are the doctors, did they have the final say? Is it the team? Is it the players? Is it some sort of collaboration?
So it's a complicated thing, and there's definitely a collaboration with the players, the coaches, the docs, the trainers. Everybody has a role in kind of declaring the patient or the player ready to play and clearing the player, so to speak. And really, everybody has to clear them for them to get on the field. You know, it really depends on the type of injury as far as what the actual process is. Concussions are a great example of a very, very standardized protocol. There's a protocol that's spread out across the NFL that's implemented where they have to clear each stage as a 5-step protocol before they can be cleared. And then not only does the team doctor and trainers clear them, an independent neurologist has to clear them. So that one is the type of injury that's very standardized. Many of the other injuries aren't. You know, there's certain injuries that have basic science kind of guides us. We know approximately how long it's going to heal and how much time has to pass for there to be enough healing that it's safe. So we can say, all right, well, it may not be completely healed, but it's strong enough to get out there. Then there's also the idea that the patient, the athlete's strength and range of motion has gotten recovered to a point where it's adequate. You want to be at least 80% as strong as the other side or 80% as strong as you were before the injury. And then on top of that stuff, you got to make sure they're not having pain and symptoms that are, limiting their ability to play. You got to make sure they're able to play their position. You don't want a lineman going out there when they're not ready, putting your quarterback at risk because you can't play. So really, it's everybody. There's a time that has to pass, and depending on the injury, there's different timelines. Then you have to make sure that the strength, range of motion, functions there, and that the player actually feels good when he's on the field. If all those things are, check all those boxes, then the coach starts to say, well, we actually have someone better or not. So that all those things have to play a role.
All right, great stuff this week. And before we let you run, Drew Brees, the thumb ligaments, in the throwing thumb there, we saw the play last week. They're saying 6 weeks. Does that jive with you?
Yeah, that's a rough approximate timeline for recovering from the surgery. So that ligament that they're talking about in the thumb is on the inside of the thumb, and it plays a really major important role in your ability to grasp or grip. And it's incredibly important for throwing athletes. Like in a lineman, they probably would cast it and allow them to continue to play. It's just different when you're the quarterback. So now they had it surgically repaired. Typically, it is about a 6-week timeline. Sometimes they can push people back maybe a little bit earlier, although it takes much longer for the ligament to completely heal. In approximately that amount of time, it will be strong enough for him to get back to throwing and hopefully playing at a very high level.
Today's injury report brought to you by Cape Regional Health System and Dr. Kevin McHale with Penn Orthopedics and Cape Regional Health System, the best of both worlds for a healthier life. For an appointment, call 609-463-CAPE or visit caperegional.com/orthopedics. Well, we hit a lot of great topics there, Doc. We appreciate it, and hopefully some of these guys, I don't know, I would imagine Jackson, Goddard, and Jeffrey don't look like they're going to play on Sunday.
Yeah, and with the Thursday game following, it's a bad time for all these injuries to happen. So it seems like I'm probably looking at 2 weeks for a lot of them, but hopefully we see them back in the field pretty soon.
All right, well, we will check in with you next week here on the Sports Bash. Thanks, Doc.
No problem. Talk to you guys soon.